In the last few years, our country has seen an unprecedented change in the economy, and dentistry has not been immune to that. We've seen patients who are not only deferring elective care, but they're also deferring care they need on a regular basis. Recall visits, checkups, regular x-rays. They just simply can't afford it, or the insurance isn't there anymore because people are losing their jobs. We're at the 2009 CDA convention in Anaheim, and we're talking to dentists about what they're doing to help their patients out, how they're communicating the need for regular recall with their patients, and what they're doing despite these troubled times.
Well, absolutely we are. I think everybody has.
I've had definitely a decrease in the number of patients that come in over the last 6 months to a year.
It's down, but we make sure that we do things to overcome that.
We are trying to be very proactive in talking about prevention. We're also making payment schedules very flexible, where CareCredit and these different outside financing companies have helped us to make it affordable for people.
I encourage them to do good home care and at least do the hygiene appointments and take care of any active disease so it doesn't get worse. But anything that they can wait on a couple of months, a year, I try to be as honest as I can what they can wait on.
There are some patients that defer care. They always have. We're seeing a little bit more of that now than we used to. Some people are just saying they can't afford the treatment, or they only want to do part of the treatment plan rather than the whole treatment plan.
We stress to the patients to keep up with their oral health care. The reason is it always costs more if you don't prevent it in the first place.
Last couple of weeks I've been doing extractions on patients that delayed care and didn't get the cavity done or the root canal done, and now that tooth is non-restorable.
What would have been like a simple cleaning, now we've got all this periodontal disease infection going, and needing multiple appointments to try to get them caught back up.
We understand that everybody has a time when they can afford dentistry, and so they need to be able to work it into their budget, and we are sensitive to that. We are trying to make payment arrangements more flexible. We are trying to do spacing out or phasing care so that they can handle the most urgent things now and maybe put off something for 3 to 6 months.
With these patients, I'm trying to provide more personal contact with them to let them know their specific situation and figure out ways that we can maintain them without them having irreversible loss or damage to their oral health, and figure out a way that maybe we can maintain them until their financial situation allows them to have the required work that they desire.
In these tough times, it's very imperative that the dentists remember that the lifeblood of the practice is the patients. And some of these patients have been in our practices for years. We want to help them find ways. Third-party financing, stretching out treatment where possible. These are the things that we can all do to help patients get through these times and also build our practices in the process.